Unlock the power of your mind. This is Provocative Enlightenment with Eldon Taylor.
Welcome to another hour dedicated to inquiry, reflection, questions, possibilities, and more, all in our effort to understand exactly what enlightenment means and what it might be to be enlightened. Indeed, an hour devoted to learning something more about ourselves, an hour designed to help us understand the world we live in and enable us to integrate this knowledge in practical ways, recognizing that in the process we might just challenge some of those old ideas about the world we live in and the people we have become. For this is an hour where we strive to evaluate knowing as inseparable from the total experience of reality. I'm Eldon Taylor, and this is Provocative Enlightenment. Every week I read some of your letters as our way of respecting the very important role you play in helping us to make this show successful. Last week our guest was Keith Busha, and we spoke about the conscious community of Damanhur. Mark wrote, in today's radio show, Mr. Keith Busha discussed the merits of Damanhur eco-society based on ethical and spiritual values. The society focuses on the collective and how members can thoughtfully contribute to the whole. I don't mind this approach for small communities which seek to awaken the individual to his true inner worth while giving of his gifts to the community. I think such groups can be a true catalyst for positive change in the world. However, on the national scale, such ideals as seen in Damanhur can be encouraged but never regulated. Individuals need to have the freedom to choose how they give to the community. Well, thank you, Mark, for your note, and I do agree. On a mass scale, say the size of an entire country like this one, this would be a very difficult matter to manage, if at all possible. That said, the people of Damanhur would likely inform both of us that the individual does have the choice, and the teams that they are placed on are of their choosing. I find the community of special interest since it is so work-oriented that by choice, citizens do what they do, work as a passion for 12 to 14 hours every day. There is only the idea of contribution to the whole, as opposed to entitlement for some, from some, the kind of nonsense that we see proliferating in some areas of our country today. Johnny wrote, to me, the merit of Damanhur is that it models a different way of living and allows us to more easily question our own values, which may in many cases mirror our society at large. April wrote, I checked them out. Some of their work is amazing. The art, the science, the passion, the spiritual, as you said, all of it working together in the individual and then the larger community. I, too, am impressed by that, April. Indeed, I think of it this way. When the heart and the head are aligned, everything else seems to be as well. All right, that's all the time we're going to take for letters, but I do invite you to opine by sending your email to eldon@eldontaylor.com or by joining me on Facebook. You can also just leave comments on my website. I do try to read all of your letters. Obviously, we can't get them all on the air, but they do impact our programming, and I thank you for your support. Now to today's show, energy medicine. Energy medicine includes what? Therapeutic touch, cranial sacral therapy, homeopathy, acupuncture, tapping, light therapy, magnetic therapy, qigong, reiki, Ayurvedic medicine, crystal healing, radiation therapy, cymatic therapy, tuning fork treatments, organ and prana treatments, and on and on and on. In short, although philosophies and methods may vary drastically, there is one central idea, and that is that the body's energy is unbalanced and needs balancing. All right, now, according to the Skeptics Dictionary, energy treatments are thought of as just so much hocus pocus. Reading from the dictionary, and I quote, in physics, the basic idea of energy is the capacity of a physical system to do work, the product of a force times the distance through which the force acts. In physics, energy is a term to express the power to move things, either potential or actual. Energy is not a thing itself, but an attribute of something. New Age spiritualism has co-opted some of the language of physics including the language of quantum mechanics in its quest to make ancient metaphysics sound like respectable science. The New Age preaches enhancing your vital energy, tapping into the subtle energy of the universe, or manipulating your biofield so that you can be happy, fulfilled, successful, and lovable, and so life can be meaningful, significant, and endless. Of course, New Age energy has nothing to do with mechanics, electricity, or the nuclei of atoms, the stuff of physics. There are no ergs, joules, electron volts, calories, or foot-pounds in New Age subtle energy, which will remain forever outside the bounds of scientific control or study. Close quote. Now, by contrast, our guest today argues that energy medicine is the medicine of the future. Indeed, according to his new book, Energy Medicine, and you'll want to definitely read this one, but according to the book, and I quote, history and even today, conventional medicine could at times be brutally primitive. And although everything that exists in our world is made up of energy of some sort, the approach of treating our whole and energetic bodies is not yet accepted by conventional medicine, but rest assured it will be. Close quote. Now, Candace Pert describes in the foreword to a pricey book also titled Energy Medicine. Don't confuse that one with today's, with our guest's book. It's subtitled The Scientific Basis, and it's by a Dr. Osham and Candace Pert. But Pert essentially says that some energy, that Dr. Osham pulled some energy away from her stagnant liver. Let's try that one. Liver. Quoting Dr. Harriet Hall, Pert tells us the body is a liquid crystal under tension capable of vibrating at a number of frequencies, some in the range of visible light, with different emotional states, each with a predominant peptide ligand-induced tone, as an energetic pattern which propagates throughout the body. Close quote. Now, Dr. Harriet Hall believes Pert is losing it. Indeed, in a paper titled Confessions of Quackbuster, she states that the evidence supporting the various claims underlying energy medicine is, and I quote, of poor quality and is outweighed by negative evidence. She continues addressing those who would argue for positive research findings this way. Science is not a matter of cherry-picking whatever supports your hypothesis. Rather, it is a self-correcting methodology where all the evidence is considered and critiqued and competing hypotheses are tested. But energy medicine would include such things as radionics, and I have some personal experience with the effect of certain radionic frequencies, at least when rendered in the audible sound range. Indeed, I once conducted a pilot study with a spinal network using frequency patterns. The results, every person in our experimental group reported an increase in ambulatory ability and a decrease in pain following our 30-day trial. That is, everyone but for one. This one person reported that they knew they must have been assigned to the placebo group since their audio program sounded like a motorboat, so they didn't play the program. Well, frequencies might sound that way. Anyway, okay, to settle this argument is a genuine icon, a man I've looked up to for many, many years, a pioneer of energy medicine, Dr. Norman Shealy. He is an inventor, a medical doctor, a neurosurgeon, a psychologist, author, pain management expert, and the founding president of the American Holistic Medical Association. For over 3 decades, he has been at the forefront of alternative medicine and healthcare. He invented the TENS unit, and nearly every healthcare professional today is familiar with this device in some way or another. I don't know of a sports situation where the TENS is not employed by sports psychologists, sports trainers. He is also the inventor of the dorsal column stimulator, a subcutaneous device that has wires that are implanted next to the spinal cord, which discharge an electrical current to block pain impulses in cases that involve severe and intractable back pain. Dr. Shealy also is the inventor of a surgical procedure in which nerve fibers are cut to reduce pain coming from the joints of the back. Dr. Shealy and his wife of 40 years, Mary Charlotte, live in Missouri, where she is also known worldwide for her success-centered writing and training stables. Okay, today is your chance to speak with Dr. Shealy. We will take your calls in the second half of the show. So if you have a question about energy medicine, be sure to give us a call or put your questions forward in our chat room. All right, let's get our special guest in here. Welcome to Provocative Enlightenment, Dr. Norman Shealy.
Well, thank you. It's great to be with you. Have a good one.
It is our pleasure. Indeed, I'm very much looking forward to this, sir. But first, you have a classical training in traditional allopathic medicine. You are, after all, a surgeon, a neurosurgeon. So share with us how and why you became interested in energy medicine.
Well, obviously, in my training, we were cutting the spinal cord and destroying the front part of the brain to control pain. And I not only thought that it was sort of barbarian, but I was wondering whether the patients and the physicians were crazier. Because when you destroy part of the spinal cord, long term, you get an 8% success rate. That's science. I mean, I don't think something that gives you an 8% long-term success rate that destroys your ability to have sex and a few other things is what I would call true science.
No,
so I set out to find alternative ways of controlling pain without killing the nervous system. And as such, that's how I got into using acupuncture back in the mid-'60s. And from there, using biofeedback and autogenic training and a wide variety of related techniques, and eventually into the broader field that we now call energy medicine.
Okay, now you heard the setup piece, Dr. Shealy, and there are those that insist energy medicine is just another New Age mumbo-jumbo mantra and makes no sense whatsoever to true scientists. You're also a scientist. From my perspective, often what happens here is someone makes a statement or a claim that's ludicrous, and that becomes the attack point from which the entire field is discredited in one broad brushstroke. However, Candace Pert has some real credibility. So when her work is attacked, it brings a different weight to the issue. What do you say to those who would discredit the field of energy medicine?
Well, I tell them to look at the field of pharmacology and the current situation, for instance, just with antidepressant drugs. There are 4 major articles, including one in the New England Journal of Medicine, that emphasize that if all the negative research studies on antidepressant drugs had been allowed to be published, the net result would be 0. In other words, science is not always honest and open. And in my
especially
opinion,
when there are dollars behind it.
Yeah, the pharmacomafia has distorted the whole field.
Okay, now, are there areas of energy medicine, or perhaps I should broaden the question to include any and all alternative methods that you do call into question?
Well, obviously, I think we need outcomes. And if you don't have an outcome, I'm not particularly impressed. There are a number of devices that supposedly measure everything in your body just by holding a metal probe in your hand. And I'll mention one by name, the SCIO. I think those kinds of devices that just somehow measure the electrical resistance of your hands can tell you whether your grandmother died of pleurisy are ridiculous. And they are truly useless, and they refuse to do outcome studies. If they had any value, all they'd have to do is treat 100 people with hypertension and get an outcome, and it could be done within a month.
I'm glad to hear that. I am glad to hear that because I do. I mean, and I know that you're aware. If you live and work in a scientific community, you are going to rub shoulders with people who will attack these narrow areas, just as you point out, and then condemn the entire field as a result of it. I love your book. It's a wonderful book. It's a complete book. That's something else that I love about it. You have covered the compendium of energy medicine, and you do so in a very forthright, honest way, just as you just answered this question. But I have to ask you this before we go any further and we get into your book. Tell me about the reincarnation case of John Elliottson.
Well, of course, I had a spontaneous knowing that somehow I had been John Elliottson when I heard his name. And I set out to find out and had to go to London to seek my past, so to speak.
Uh-huh.
And I got in a cab, and I asked them to take me to the Royal College of Surgeons. But as we turned to the right, I was literally picked up in the back of the cab physically, and an iceberg down my spine, and I had to go the other way. And I walked into the building where John had practiced, and I knew every room in the building. And I have had my past life as John confirmed by over 75 excellent intuitives.
Wow. Now, John Elliottson, for the record, was the first professor of medicine at the University College Hospital of Medicine. And he was instrumental in bringing several techniques to England, including mesmerism. The use of magnets, hypnosis. James Ray changed that to hypnosis, as you know. But mesmerism, originally Mesmer used the magnets. Do you have direct memory of that? Did you employ that, or do you employ it at all today? Hypnosis and magnets and/or?
Well, I have done some work with magnets. For instance, there's a magnetic bed created by Dr. Bondley in Canada, and just sitting on that lowers your blood pressure significantly. Lying down on it takes your brain on an EEG recording deeply into relaxation within seconds. And so I have done some work with magnets in this life, and I'm quite good at doing hypnosis, even have done a couple of mesmeric passes over people. I think hypnosis is more effective than mesmerism.
I would totally agree with that, but now I'm going to ask you one more before we get it. John Elliottson was also like best buddies with people like Charles Dickens and William Thackeray. Do you have any recall of that kind of conversation, those kinds of, and if so, has that influenced your writing at all?
Well, obviously, my favorite author as a child was Charles Dickens. And, of course, Faulkner wrote a book dedicated to John in which he called him Dr. Goodenough. I actually had an out-of-body experience in 1974 where I visited Olga Worrell, the great healer, and saw her walk across the room and pick up a book and put it down. And I called her later and asked her what the book was, and it was Faulkner. It was the book dedicated to John Elliottson.
Wow. All right, let's get into your marvelous book, Energy Medicine. You state that this is the future of healthcare. Flesh this statement out to us. I mean, what do you base this assertion on? I know you're outcome oriented. You've already pointed that out. So, what do you base this statement on?
Well, let's look, for instance, at some of the circuits in the human body that I have discovered in the last 15 years.
Okay.
These are as close to energy medicine as anything can be. That is, human DNA resonates, that means to me vibrates, at 54 to 78 billion cycles per second. And if I apply those frequencies to very specific acupuncture points, I can selectively raise dehydroepiandrosterone with that same circuit, because these would be diseases of fire. I could successfully treat, and these are published data, 70% of people with depression, 80% of people with diabetic neuropathy, 75% of people with migraine, and 70% of people who have failed conventional medicine with rheumatoid arthritis. That's just one of the 5 circuits. Of course, my most recent work has turned back to the ring of air, where we demonstrated over 10 years ago that it raised a neurochemical called neurotensin, which is a neuroleptic, which means, well, as one of my patients said, Doc, this stuff's got street value. It actually makes you feel remarkably relaxed and detached. And now in the last couple of months, I've demonstrated this, stimulating this circuit with these electrical frequencies will raise oxytocin, the bonding hormone. And now I've taken it a step further, and I've produced a blend of essential oils, which, when applied to these specific points, 13 of them in this case, raises oxytocin and makes people feel wonderful. Now, that's energy medicine.
Okay, and that would be the bliss material.
That is what I call bliss.
Yes, you sent me a sample of that, and with the instructions, and that is amazing. I have to tell you that the idea of just putting a little, sweet-smelling oil on a few points of the body and having it somehow produce a neurochemical change was. I must admit that I was somewhat resistant to that, but because it was you, I had to do it, and it has a remarkable effect and a very noticeable effect. So, and that is called bliss, and everybody can find that on your website. Is that not true?
That is correct, and I'm I've got over 300 people now who have used it, and all but 2 of them have thought that it's marvelous, and that's pretty good.
Yeah, it's very good. Now, I suppose I should, in the interest of being candid and honest, admit to everybody out there that I am one of your customers. I visit your website on a regular basis. You have a lot of things there that are just a part of my daily activities. Ranging from the vitamins to some of the other products that you're discussing right now. All right, Ben Venisti, you talk about him in the book. We have about 1 minute. Before we have a hard break coming up, my understanding is he is laying patents down right now on frequencies that simulate, if you will, say penicillin. According to him and the work that I've seen, the frequency of penicillin is as effective as the drug. Your take on that?
I think anything's possible, but I'd like to see the outcome. That's one that you can easily test in a petri dish with some bacteria.
Are you familiar with the patent process that he is working with on that?
Well, I'm not familiar with his particular patent process, but theoretically, if he can show that a petri dish with some streptococcus in it is killed by these frequencies, then he's certainly got a phenomenal energy patent.
Right. All right, well, we have a hard break. You're listening to Provocative Enlightenment on Hay House Radio. We're talking with Dr. Norm Shealy about his terrific new book, Energy Medicine. We have links on our website to Energy Medicine. You can also find this book. I'm sure you can find it in all the bookstores, brick and mortar, as well as online. I know it's on sale at Amazon. That's where I got my copy. It's a truly great book if you're at all interested in the compendium of energy techniques and tools and the science behind them. From crystals to tapping, from what you eat to what you say to yourself, you want this book. All right, if you're not already in our chat room, now's a great time to go there, join the conversation. We have a short video for you that explores today's subject, and as they say, a picture is worth 1,000 words. So just go to eldontaylor.com/chat. Stay tuned. You won't want to miss what's coming up next after these words from some of our friends.
Confusion, deception, manipulation, feeling a bit controlled, lost. Learn how you can take back control of your life through proven techniques in Eldon Taylor's revised edition of Choices and Illusions. This New York Times bestseller is a guidebook to your journey to self-actualization, filled with practical, real-life solutions backed by scientific studies and guaranteed to awaken your inner genie. Get your copy today from all books.
Have you talked to yourself lately? What does that inner voice say? Are you constantly hearing negative feedback? Ready for a change? Inner Talk, Eldon Taylor's patented subliminal technology, can do just that. Change your inner self-talk. Turn off the negative by replacing it with positive affirmations. Inner Talk has been researched at universities such as Stanford and by governments around the world and has been proven effective at priming your self-talk. Armed with a new positive outlook, you'll find everything becomes easier, from losing weight to stop smoking, giving presentations to riding horses. Learn new things to being a powerful salesperson. Choose your title for change today. Visit www.innertalk.com. That's INNERTALK.com. Innertalk.com.
Unlock the power of your mind. This is Provocative Enlightenment with Eldon Taylor.
And welcome back. If you just joined us, we're discussing the wondrous world of energy medicine with inventor and medical doctor Norm Shealy. But before we get back to the program, I'd like to invite you to join me on Facebook and or follow me on Twitter. Be sure to also subscribe to my free newsletter when you're at eldontaylor.com, getting your free InnerTalk MP3 downloads. Don't forget, take advantage of that. I would also like to invite you to tell at least one other person this week about our radio show. We're working on growing our numbers, and we need your help. So if you enjoy our show, please do shout it out. Share it with others. All right, let's get back to the show. Now, I promised that we would take your calls in the second half, and that we shall do. But I have one question first. Dr. Shealy, let's talk for a moment about some specific energy medicine techniques that you cover in your book, LifeWave Patch. Okay?
Okay.
I had Dr. Karen Kann and the inventor David Schmidt on this show. There were some negative statements on the web made by the Worldwide Scam Network, and I asked David about them. He answered, I thought, in a straightforward fashion that did not appear to be hiding anything. I'd used the patches, and I was quite happy with the results, and I said so on the air. But not long after the show aired, I was contacted and blasted for sponsoring what was referred to as nonsense. So now, Dr. Shealy, you cover LifeWave in your book. What's your take on this approach?
Well, I've done 4 projects now. I am not a distributor. I will not become a distributor because I like to do research. And
Good. I'm not a distributor either, but I am a user.
I would be too if I needed it. But I am in the midst right now of my 4th project on low back pain. The one on sleep, I did one that was an open label study. We got an 88% increase in length of sleep. I did another one more recently with a double-blind crossover placebo, and we got an 80% increase in the length of sleep. I don't know a drug in the world that can do that.
No.
Right now, I'm using their ice wave patches on low back pain. I'm about halfway through a study of 50 people, and we're getting equally good results. Now, never 100%. I always say we can't determine who's dead or alive without going to the Supreme Court. But, I think the LifeWave patch is a remarkable achievement, and I think David and his group have done a terrific job with it.
And it basically works on the meridian system. Again, back on the energies. Is that? I mean, that's correct, right?
Right. And interestingly, of course, the concept of feeding the infrared emissions from the body back into the body to stimulate acupuncture points makes lots of sense. After all, the Chinese even put an herb on there and light it up like a cigarette. I'd rather do it the slow way with an ice wave patch.
Right. All right. Let's go to our phones. We have several calls and some good questions for you. On line 1, we have Aaron from Washington. Welcome to Provocative Enlightenment. You have a question for Dr. Shealy, Aaron.
Yes. I'm so glad I tuned in today. My question is, if you ever use intuition or get intuitive hits with your assessments of patients, and what kind of tools you would use to increase that in a practice.
Yes, absolutely. I think all good physicians have intuitive hits, and I've been doing that since I was a medical student. And Dr. Robert Lightman, who is also one of the best intuitives that I know, spent 3 years training himself to perfect his ability to be a medical intuitive.
Oh.
It takes training.
Mm-hmm.
I mean, some people, even Carolyn Mays, who is superb, did not know the terminology. And so I worked with her several years, helping her to understand that when she said it looked as if there was concrete in the back, that was a fusion, et cetera, et cetera.
Mm-hmm.
And so, yes, absolutely, it can be trained. And unless one is a genius like Mozart or something, you do need some experience working with it.
You cover medical intuitives in your book, do you not?
Oh, yes.
Okay. Does that answer your question, Aaron?
Yes. So it would be basically find somebody who's an expert in it and maybe use their modalities, and if you can, train with them to help train yourself? Or?
That is possible. Now, Carolyn and I have the Science of Medical Intuition, a cassette or a CD program with a book on basic medical intuition. And she and I do about one live workshop a year to help people further their education and experience with this.
Where could you get that information, Dr. Shealy? Is it on your website?
We have one. It's November 10th and 11th, I think it is, next November. And it's going to be in Chicago. And shortly after the first of the year, it'll certainly be on my website.
Okay, and the cassette and book?
Now that they can get from my website, or they can go to Sounds True.
Okay. What is your website? Give your website. Best website for all of our listeners.
Norm Shealy, NORMSHEALY.com. And they can sign up for my free newsletter, and my optimal recommendations is listed there, and they can go in there and get almost all of my recommendations for holistic energy approaches to alternative approaches for disease.
A lot of information there that is absolutely invaluable, and it costs nothing, and I can say that truthfully because I've taken advantage of it. Aaron, thank you for calling.
Thank you.
Let's go to line 2 and talk to Jamal from Brooklyn, New York. Welcome to Provocative Enlightenment, Jamal.
Hi, thank you both. Hi, Mr. Taylor and Mr. Shealy and the chat room friends. This is Pencil.
Hi.
I know. I love this show, and I'm glad I got on. I'm calling because I'm new at the energy medicine, and I believe in it. But I feel like for me, I was wondering, do you have to have a belief in a higher power, which I've read in some other books, to sort of tap into that energy or to that field, so you can sort of work with it? Because with me right now, I'm shaky. I don't really have a strong belief in anything, and so I think that hinders my success with other techniques that I've found through reading and research and things like that.
Well, I don't think you have to have a belief in God or a divine power, but I have to say that my experience with patients who are true atheists instead of agnostics, and there's a big difference. True atheists tend to have a pretty large block to getting well, and from my point of view, it's because they've got a karmic problem. That may sound rather obtuse, but my experience is that certain things unequivocally appear to bleed through from a previous life. The best way to find out whether or not you can benefit from some of these is probably to use one of the more energetic tools, like an electrical stimulator for pain control, because that's pretty physical, and people who don't have any great belief certainly can benefit from the physical use of electrical current.
Okay, and I wanted to say that I do believe in God, and I think for me, as from my own perspective in my life, I feel like I don't sometimes feel like I'm good enough to be in that energy.
I'm so glad you brought that up now.
Yeah.
Hey, that's, in my opinion, the number one illness in the world is poor self-esteem.
Okay.
I'm not good enough. And remember this, you're okay because God does not create junk.
Okay.
And And that, to me, is a critical thing that people need to be aware of. And that's one of the reasons I'm doing so much work right now on oxytocin, to give people back that ability to feel nurtured.
Thank you. I think that your book, Energy Medicine, is probably one of the must-reads of 2012 for me. I live in Brooklyn, and it's sort of somewhat of a struggle now, but I think that's one of the things I definitely want to get my hands on, because I've heard you talk about white magic and talk about other things, and I said, well, I need to get this in one concentrated pack, and I think that's what you did in this book, where I can sort of go through it, thumb through it, and because I am into it. I just, I need to get, I think this one would be really powerful for 2012.
Great. Go for it, and my blessing.
You'll love the book, Jamal.
Thank you. Thank you both.
Thanks for calling. Okay. Dr. Shealy, I had the great advantage, I guess, of being the sports psychologist for a number of the members of our the first Olympic judo team that we put on the field in Barcelona, the Barcelona Games. And when you're talking to a martial artist and you talk about energy, to tell them there is no such thing as energy, that's really kind of laughable. And to come back to something that Jamal was kind of saying there, having to do with the use of energy, in working with some of these athletes, when you get that athlete that is really hesitant, maybe they're also, a medical student, and then we have athletes that are very bright people, who's hesitant about the energy, their ability to bring energy in or to manipulate energy, to push it out. And your ninth dan black belts in various martial arts will tell you that they are actually pushing energy onto their opponent, which is causing the opponent to do or to move in ways that they have anticipated. They do seem to have a problem with actually, performing physically in ways that those that do bring energy into their body are able to do so. So when you say it's karmic, and I wouldn't discount that at all, is there also possibly a resistance? I think of like electricity. Is there, some resistance that minimizes the amount of energy they're able to bring into their body and or to cause to move properly in their body?
Absolutely. Again, this feeling of I'm not good enough, whether it's in sports and athletics or not. I worked with the football team, University of Wisconsin lacrosse, back in the 70s. They'd been at the bottom of their league. I just gave them this concept of using visualization and positive imagery, and that year they were co-champions.
Wow. Yeah. Okay, and I totally agree with you, self-esteem. My research supports all that. All right, let's go to line 3. We have Carla from Pahrump, Nevada. She's out there in the land of coast-to-coast radio, Pahrump. Welcome to Provocative Enlightenment, Carla.
Thank you. Good morning to you both. I'd like to stay on the physical plane for just a moment. Dr. Norm, I want to just thank you from my husband because your magnesium lotion solved his arrhythmia when all of medical science could not. So thank you so much for that.
Oh, thank you.
Amen, amen. I use that,
to get
too.
Those stories.
And I use it, too. I use all your products for preventative, so it's hard for me to gauge stuff except that I'm healthy, so it must be working, right? But my question today, I've got a lot of your all your ring programs and different programs, and I'm working with other folks to help them heal their bodies. And can you speak a little to my left brain so that I can share how these work with the people who don't have the trust that I do in the energy medicine?
Well, everything in our body is electrical. And basically, that's how I started out in neurophysiology 50-plus years ago. So we know, when I speak, I'm using electrical current from my brain down through the muscles to those that allow me to speak, etc. And so when we use tapping, for instance, even on one of the points of these circuits that are electrical connections that, for instance, raise neurotensin or oxytocin or DHEA or what have you. Basically, the body is piezoelectric. That is, it's like a giant quartz crystal, and when you tap it, it actually produces an electrical current. So it's quite obvious to me that when I massage or tap an acupuncture point, I set an electrical current up. It may not be quite as powerful as when I use the electrical stimulator, but it still works. And I've done this with hundreds and hundreds of people in workshops.
Okay, so then it doesn't matter if they believe it works or not, because it does work on a physical level.
Exactly. But, nothing is 100%. But when we can get 70 to 80% with it, that's better than most drugs.
Oh, absolutely. And I like to use like an integrated layered approach. I mean, yeah, one thing doesn't solve everything, but give them enough and health will result, is my belief.
Well, one woman took, after getting the rings, actually started doing the Ring of Fire on her husband and doubled his testosterone level within a month.
Wow. Well, we just want to, I'm not working on my husband. I'm working on people that are ill. So that's great. I'm so happy. And thank you for all your good work. And is your book compilation of all your research? Because I do have a lot of things, or is there some new information in it?
Well, it has summaries of much of my research.
Okay.
And it also has a lot of new information.
You can go get my curriculum vitae off my website and find every article I've published.
Okay. All right. Well, I'll put that on my Santa list on the number one spot then. Thank you guys so much.
Thank you.
All right. Let's go to Madeline in Chicago, Illinois. Madeline, you've been very patient waiting on the line. You're on the air with Dr. Shealy. What is your question?
Thank you for taking my call. I wanted to ask Dr. Shealy his thoughts, and maybe it's the same thing, with energy healing versus mind-body connection, and how successful that energy medicine is on back issues. I'm trying desperately to avoid surgery.
Well, of course, there's a wide variety of energy approaches to use in the back. I mean, let's confess, chiropractic is an energy approach. Osteopathic manipulative therapy is an energy approach. And those are some of the excellent things. I see every other week at least one of the most wonderful body therapists in Springfield, Missouri, David Snelly. And David works on the fascia better than anyone I've ever seen. The fascia is that spiderwebby stuff that connects us from the head to the toe and everything in between. And he can be rubbing my left foot, and I may feel it in my right ear, because that's where the fascia is so restricted at the moment. And so, yes, this kind of work, massage of all kinds, deep body work, all of these are energy approaches that can certainly do wonders for back pain.
Would you be able to tell me or guide me to where to go in Chicago? Any practitioners that you have worked with?
Yeah, there's an osteopathic. I would always start with that osteopathic college in Chicago, because they do osteopathic manipulative therapy. And if there's anyone, who can do it in that field, you would find it there.
Thank you very much.
That's the competent school.
Thank you.
Thanks for calling, Madeline.
Thank you.
All right, let's go to Linda in Portland, Oregon. Linda, welcome to Provocative Enlightenment. You have a question for Dr. Shealy.
Yes, I do, and thank you for taking my call. I really appreciate hearing about this work. I'm sorry I've not been introduced sooner, because especially this new product, or this product that I've that's new to me, Bliss. It sounds like something my family could use, and it's something we're all trying to strive for in being healthy. But I had a question. My mother was a cancer survivor of multiple myeloma, and the diagnosis is very bleak. When she received her diagnosis from the doctor, she asked them, well, how long will she live without radiation and chemo? And they said a year. And she says, well, what if I have it? And then they said 2 to 3 years. And in her sense of humor, she said, well, I guess I'm going to die, because I'm not going to do that. So she progressed in her life and did everything naturopathically. And last month she passed, and what happened was we all kind of are involved in this energy healing work, but not verbally. It's just something our family does. I mean, some of us are Catholic, some of us are, just spiritual, or some people not even have a lot of, ties to any type of religious belief. But we just puttered along and we did our little thing. And I guess my question is about energy. In the hospital, she survived some mishaps of, modern medicine, and all of her life she had always done things naturopathically. And my question is, we all kind of freaked out at some of the things the doctors did and said, and I'm just wondering, could that have been, because she performed a miracle. Again, in the hospital, they said she will never get off life support after she aspirated on one of their pills. She did this, and one of the doctors decided to treat her as a hospice patient and basically fed her 20 cc's of, their nutritional drink they have. And she went actually 3 and 4 days without food and starved to death in the hospital. But and we came to the information because one of the professionals leaked it to a reputable source. So I guess my question is, did we just kind of bomb out at the end, or was it could have just been timing? But it just felt like there was a lot of energy, negative energy, transmitted by our fears.
I don't think there's any question that, and to me, I consider it psychic malpractice on the part of a physician or nurse or anyone in the healthcare field who makes negative statements in the presence of a patient. In fact, I don't think they should make them about the patient even out of the presence of the patient, but definitely not in the presence. Because even when patients are asleep, they often can remember what was said in the room.
Yeah.
So but nobody's perfect.
Yeah.
And the research further does show that indeed those patients take that aboard and they act in reliance on it. I don't want to take up the time there, but there is a lot of research that substantiates the need for physicians to carefully guard what they're saying to the patient, and not just guard what they're saying, but guard how they're acting. I'll be quiet, Dr. Shealy. Go ahead.
No, I totally agree with you, and it's just, I think, nobody's perfect, but...
Well, it was a panel of doctors, and they were almost hostile at the suggestions that we were making, and it was like it was a personal affront to their professionalism. So, I mean, I've just lived with miracle after miracle in the last 12 years, and it just seems odd that it just took such a quick turn. But I do appreciate that you are scientifically proving, again, like all of these, actually putting some weight behind the tapping, behind the, acupuncture, all the things that my mom cherished. So I appreciate that very much.
Well, blessings on you. And, we just do what we can do. And when it works, it can be marvelous and sometimes miraculous. Miraculous,
definitely. Thank you very much.
Thank you.
One other thing I'd add, Linda, and we're about out of time, but you don't want to blame yourself. You don't want to feel that you let your mother down in any way, shape, or form.
Right.
That's very important. We appreciate your phone call. Thanks for calling. Dr. Shealy, in about 30 seconds, tell our listening audience again how they can reach you, subscribe to your free newsletter, obtain more information, and more specifically, where's the best place for them to get Energy Medicine, your new book?
Well, it's probably easiest and quickest on Amazon. If they want a signed copy, I'd be happy to give them, to get it off my site, which is Norm Shealy, NormShealy.com.
NormShealy.com, a signed copy. Same price as Amazon, or?
Unfortunately, they sell it cheaper. They probably buy hundreds, thousands or something more than I can.
I know they do that to me on my books as well.
But if you call them, you tell them I said you could have it with no shipping charge. And
hey, that's the deal. That's the deal. Well, we certainly appreciate you being with us today, Dr. Shealy. We've come to the end of another hour of Provocative Enlightenment. I want to thank you all for joining us, and I do hope you've enjoyed our show. We're sorry if we were unable to get to your phone call, and, those of you in the chat room that advanced questions, I apologize too. Too many people. Until next time, wherever you are in the world, remember, believing in yourself always matters.